Hello and welcome. Thank you for joining us today for our first Haiti COVID-19 Preventative Response Consortium webinar. We are so pleased to have everybody here from both Haiti and the States. Again, thank you. Oh my God, oh my God. Unite the hearts of thy servants and reveal to them thy great purpose. May they follow thy commandments and abide in thy law. Help them, O God, in their endeavor, and grant them strength to serve thee. O God, leave them not to themselves, but guide their steps by the light of thy knowledge, and cheer their hearts by thy love. Verily, thou art their helper and their Lord, Baha'u'llah. I'd like to introduce our moderator and the board president of the Raising Haiti Foundation, David Hoffman. Welcome, David. Thank you.
Thank you, Mariah. Thank you so much. And welcome, everyone. So glad that you could be with us today. Raising Haiti really is very honored to be working with our core partners, the Haitian organization Smallholder Farmers Alliance and the Parish Twinning Program of the Americas, who have over nearly half a century paired or twinned over 300 US churches with counterpart parishes throughout rural Haiti. In one-on-one relationships of support, we were working with both of these organizations to develop programs that would expand upon the extraordinary support that PTPA has mustered over decades while bringing the time-proven programs of SFA to many additional Haitian communities. Then COVID-19 hit, and we realized we needed to spring into action together. As we did, we found other partners ready and eager to join this effort. You'll hear from some of them during the next hour. What we've been discovering in virtually all of these recent connections is that there seems to be a new movement stirring. It's a movement of the heart. Souls, even among the leadership of the most formidable institutions that have been working in Haiti for decades, are articulating the need to come to this challenge with a humble posture of learning, working together. There's an evolving realization that while we may have worked in isolated spheres in the past, individuals from diverse backgrounds and Haiti-interested NGOs must work together to find creative ways to accompany the people of Haiti to mitigate the terrible impact of COVID-19. So I'd like to open by introducing Steve Sarowitz. Steve is the founder and chairman of Paylocity, a leading US provider of payroll and HR solutions. He's an international philanthropist with an interest in promoting unity by and promoting universal education and advocating for the elimination of racism, sexism, nationalism, and religious prejudice. He serves as executive producer for the award-winning documentary Maya Angelou and Still I Rise and the Gate. Dawn of the Baha'i Faith, a groundbreaking documentary about the founding of the Baha'i Faith. Steve, together with his wife Jessica, also created the Julian Grace Foundation, an entrepreneurial private foundation that does high engagement granting, making in order to create a just, unified, and hopeful world. And I'm not sure that any of us would really be here right now if it wasn't for the support of the Julian Grace Foundation. They've provided Raising Haiti since my involvement in 2016 and more. Just a few weeks ago, Julian Grace reached out to all of its donor recipients and invited all of us to make a special grant application for up to $25,000, any work that we were doing anywhere with respect to COVID-19. It was a very quick offer. It was, again, limited to $25,000, but at the end of the application, they asked, what would you see in the future in terms of needs for this COVID-19 issue that's rising? And asked everyone to fill out that portion of the application, which we did, we heard back from them within, I'd say, 72 hours, and they indicated to us that they were tripling their maximum of $25,000. They provided $75,000, which is something that I think is not often heard of in the arena of these kinds of foundations. So it's really been what set this whole process in motion. So it's fitting that I am able to welcome and introduce to you Steve Sarowitz. Welcome, Steve.
My wife and I really want to give my wife a lot of credit for this, decided that we would use our resources during COVID and really double down. Instead of being conservative, we had a little extra money in our foundation. We called and contacted, we support over 50 different nonprofits, and we supported a lot of nonprofits. The money has to be used when the money is needed. So we contacted a lot of people and said, look, we'd like to help you now. This is a crisis for humanity. And those of us who are blessed with having more need to step up. And we did step up, but I encourage others too. We can't take it with us. And at this point in time, we're here to help each other. And as you said, David, one of our things is really talking about us being one human family. And so if I can help someone in Haiti, if I can help someone in Hawaii, if I can help someone in Israel, if I can help someone in Russia, I want to do that. We really are fighting this all together. And the more we understand that, frankly, if we understood that before this happened, this wouldn't have happened. It would have stopped the whole crisis. If we had really realized that we were one human family, and that the most important thing is our collective health, this whole crisis could have been averted.
Thank you, Steve. Thanks for sharing that, and thank you for being here and all that you do. I'd like to take a moment now and introduce our next guest, Dr. Nat Seguerin. He's the County Director for the Caris Foundation in Haiti. After medical school at Cambridge University, he completed his residency in pediatrics at Guy's and St. Thomas's Hospitals in London. He's a member of the Royal College of Pediatrics and Child Health. As a Fulbright scholar, he completed an MBA and an MPH at Johns Hopkins. He helped initiate the Caris Foundation's activities in Haiti, which have grown from supporting one single hospital to over 125 clinical sites in every province of the country. His research interest is focused primarily on efforts to reduce mother-to-child transmission of HIV and to improving the outcomes of children and families living with the disease. Dr. Sarogin, so nice to have you with us.
Thanks very much, everybody. Thanks for the invitation for this meeting, and thank you for the work that you're doing in Haiti. I was just asked by Hugh Locke to give a quick update on the medical situation in Haiti right now. And as of yesterday, as late last night, the country had identified 1,160 confirmed cases with DNA testing. And we have 1,160 suspected cases and only 151 confirmed cases with DNA PCR. Of those, 12 patients are known to have died. I think we're really about a month behind the situation in America and Europe. We only got our first cases about 7 weeks ago. And within that 7 weeks, it spread to 9 of the 10 departments in Haiti. So it's a widespread pandemic throughout Haiti as well, and is spreading rapidly. And I think within the next 2 weeks, we're going to see, larger numbers of people being identified. The number of tests, I think, is a bit misleading, because we only have about access to 4,000 tests for the whole country since the beginning of the epidemic. And we know that the testing is actually not particularly reliable. Even with the DNA testing itself, you can have up to a 20% false negative. So I think something that guides me in particular is really that looking at the number of deaths that we've seen of suspected COVID, and that's hovering around 151. 12 deaths. 12 deaths, 151 cases. And that's and if we look at the Dominican Republic, which is our next door neighbor and had the first cases of COVID probably 8 weeks ago, so a couple of weeks before us, they've had 10,000 confirmed cases and 388 deaths. So again, we're probably 2 to 3 weeks behind the Dominican as well. And the situation in Haiti is right now, people are coming in from the Dominican border, often who are with symptoms from the Dominican because they cannot get free healthcare there. That's Haitian diaspora coming back. And the patients presenting to the Haitian hospitals tend to be extremely sick. So coming in with advanced symptoms and often, close to death as they come in. The government have closed down schools and have given orders of a curfew. So after 8 p.m. at night, you're not supposed to be out. But really, social distancing is very, very difficult to do, especially in Port-au-Prince, a city of about 5 million people. People are, a lot of people have to work to earn money each day to provide food for their families and have to be able to, purchase food on a daily basis. So social distancing is very, very difficult to do. I took a drive through Port-au-Prince yesterday and, could see a lot of people walking around. The markets were quite full. And only about 30% of people were wearing homemade masks. The government have mandated the use of masks, facial coverings in all public spaces, but the availability of masks to purchase is very, very limited. And in the hospitals, we have extremely limited PPE. The supply of masks has been stopped coming through the US. The US government forbade the export of N95 masks outside of the US. So that made it very complicated for us to try and purchase those disposable masks and gowns and facial shields. So that is a real problem for all of the medical facilities dealing with COVID. We have very few oxygen tanks available within the country. Most hospitals refill large oxygen tanks to provide oxygen. The number of sites that can generate oxygen is down to a handful of sites, probably less than 5 hospitals in the whole country that can actually produce oxygen. So, we're struggling to find oxygen tanks to buy. And we have less than 100 ventilators in the whole country that are functional. And I would probably estimate that to be about 60. And right now, most of those ventilators are already used. So our capacity to take on new cases is very, very limited. The same goes for BiPAP, CPAP machines, those non-invasive forms of respiratory support. So again, there's a global shortage of these machines. It's very difficult to purchase them and with long lead times. And we probably have about 80 of those machines functional right now. So medication, we don't really have access to the lopinavir, ritonavir medications or the other medications that have been shown to work, and I think that won't be a big part of our response here. On the background, we're having issues with devaluation of the currency. Within the last 2 weeks, we've seen a rise, a devaluation of the Haitian gourd. 2 weeks ago it was around 93. Now it's at 106 gourds to the dollar, which will mean that our imported food, which is a lot of our rice and beans are imported, we'll start to see increase in the price of those things, which may lead to problems with food insecurity in the coming months. So, what are we doing to prepare as a kind of medical community? We've set up WhatsApp groups. We have physicians in hospitals treating cases so they can learn from each other as to the best practices, both in terms of, wearing PPE, protecting themselves, triaging patients, but also how to diagnose and treat cases with the appropriate equipment that we have. We're filling up all the oxygen cylinders that we can and transporting. And the only place to fill those up commercially is in Port-au-Prince. So all cylinders have to come from the north, the south, the middle to Port-au-Prince to be filled up. We are working with local Haitian factories to produce PPE, locally made PPE, and distributing those out. We have purchased a number of oxygen cylinders and a number of oxygen concentrating machines, but that will take another 3 to 4 weeks to arrive. Caris is involved in a large chlorine bleach production program. So we've been able to produce thousands of gallons of bleach and supply all of the main hospital treatment centers with cleaning materials that they can use to sterilize surfaces, sterilize, to wash hands, but also to treat water as well, and to give hand washing stations, to all those places. But right now things are reasonably calm. The hospitals are not overloaded with people coming in yet. We have 151 confirmed cases, 12 deaths, but I think we're at least 4 weeks behind the US. And the next 2 to 3 weeks we'll really see kind of volumes of patients, and to see just how bad it will be for us. But the sites are not really prepared. There is very limited equipment, very limited supplies, and so that is the situation in Port-au-Prince.
Dr. Sagarin, thank you so much. And thank you for everything that Caris Foundation is doing. We're going to learn shortly about the distance training program that your team, your physicians, your staff have agreed to work and to serve in that process. And we're just so fortunate to have you on board. Our next guest is Dr. Sue Carlson. She's a retired ophthalmologist who has worked for 20 years with the people of Mador, Haiti, through the Haiti Committee at her church, Our Lady Queen of Peace in Arlington, Virginia. The twinning program between her church and St. Joseph Parish in Mador began in 1997 as part of the Parish Twinning Program of the Americas. In addition to chairing Our Lady Queen of Peace Haiti Committee, she serves as the volunteer executive director of the Raising Haiti Foundation, and has been for the last 3 years. And her work is just tireless and extraordinary. We're so happy to have you here with us, Sue, and it's with you.
Thanks so much, David. And first off, I'd just like to take a moment and say Happy Mother's Day to all the mothers in the audience. And I'd like to thank each of you, especially Teresa, for creating opportunities for the kids of Haiti to grow into the fullness of their potential. And now we're going to talk about Haiti COVID-19 preventative response, which we've nicknamed Haiti CPR. And we're convinced that Haiti CPR is going to help save lives in Haiti. A group of organizations have formed a consortium. We call it Haiti CPR Consortium. And the organizations help provide information and resources to assist Haitian communities in preventing and responding to the coronavirus. The organizations include Raising Haiti Foundation, Smallholder Farmer Alliance, Caris Foundation, Parish Twinning Program of the Americas, Haitian Education and Leadership Program, and LIDE. And this is what we're doing. We're coordinating a distance training to rural communities. And as part of the distance training, we're providing information on COVID-19 prevention, as well as providing face masks and printed guidelines to the 10-member community team in each community. We're also attempting to facilitate access to needed supplies. We're not sure if we'll be able to do this. We're in contact with the Haitian government and other NGOs, trying to procure face masks, hand washing stations, sanitizing supplies, and food. And we don't know if we'll be able to get any of those things, but if we are able to, we'll be able to help provide those to the various communities. And if not, we may be able to help facilitate the parishes in purchasing those for their twin communities. And the service that we're providing is available on a first come, first served basis as we're trying to figure out what our capacity is going to be. This is a photo of one of the distance trainings that has already taken place. You'll notice that the community leader is holding up a cell phone. He's wearing a face mask, and all of the participants are wearing face masks and are socially distanced. You can also see in that photo an external speaker that can be used if possible. And we'll go over this a little bit more in just a few moments. Hand washing stations have been installed in some of the pilot project communities. Another thing that's very important for Haiti CPR is the planning and coordinating that's going on. Just in the last week, an on-the-ground coordinator was hired, and a staff is being built, all going through Smallholder Farmer Alliance and help. And then the training happens by scheduling sessions with a Caris Foundation physician, who then by cell phone is able to train community teams in the prevention practices that are needed to help keep one safe from the coronavirus. Smallholder Farmer Alliance is also providing community follow-up, sending someone to each community that's been trained to make sure things are going as planned. We also are providing online educational resources, including a Creole brochure and a superhero comics. And you can, the superhero comics is really cool because it shows Haitian superheroes touting the benefits of the preventive responses and encouraging the typical person to become a superhero themselves. And all of these resources are available on our website, Raisinghaiti.org. In order to enroll a community in the program, the community has to make a commitment. It has to identify a community leader as well as team members who are going to volunteer after they're trained to share the information with as many families as possible. And as they're sharing the information, they'll be wearing a face mask and also doing social distancing. And this is how it works. First, the community identifies the community leader and then 10 other team members. So we want the whole team to be 10, the leader and 9 team members. And once we've got that team, Smallholder Farmer Alliance then schedules a training date, coordinating it with the Caris Foundation physician as well as the community leader. And then the community team will assemble at the appropriate time, wearing their face masks that have been provided by Haiti CPR, using the social distancing practices. The physician will connect by cell phone with the community leader. The community leader puts his cell phone on speaker mode or has an external speaker. And the physician then delivers a training on COVID prevention. The training usually includes about 30 minutes of education and then a 30-minute Q&A. Haiti CPR also will provide the community team with copies of Caris Foundation's COVID-19 brochure, which shows the Haitian superheroes talking about what people can do to help prevent the spread of the virus. Then following the training, and this is the really critical and key point, the team that has just been trained then goes out and trains the broader community, trying to reach as many families as possible, so that hopefully most people in the community will have learned the information. And it's really great because the training being done by a doctor at first, it helps dispel some of the rumors that are going around in Haiti about totally wrong information about what the virus is. After the initial training, Smallholder Farmer Alliance will send one of its representatives to each community to assess how the training is going, to see what the progress is, to be a cheerleader, to try to help with any problems that might have occurred, and also to provide reports. And so we're rolling out the process slowly. We're implementing pilot project with 21 Smallholder Farmer Alliance communities, as well as 18 Parish Twinning Program communities. And as these pilot communities are being trained, we're learning from our experiences. We're trying to make improvements to the program. And then once the pilot projects have been completed, hopefully that's going to happen within the next week, we hope to be able to roll out the program to many more communities based on our capacity. All the time doing communication, evaluating, and continuing to explore opportunities where we can work together. So far, there are 18 Parish Twinning Program communities that have enrolled, and I've got the list here. There and there, and there. So 14 are total definites, and there are 4 more that are pending. So if you would like to enroll your community or your Haitian twin in the program, this is what you do. First, you contact the twin parish and share information about this opportunity. And then you need to get a commitment from the pastor, or if it's a community outside of the parish twinning program, that's okay too. Just have a community leader that will identify the person who will serve as the community leader for the training. And then we have a form that needs to be completed and sent to Teresa at the email address shown here, as well as to myself at my email address. And I'm going to show you this form on the next slide. And the communities will be served on a first come, first served basis as long as our capacity allows. And this is the form that needs to be completed and sent to me and Teresa. And I think Teresa has probably sent this form to most people that are attending. But if you need the form, you can contact me or Teresa, and we'll be happy to send it to you. Also, as an aside, this whole slideshow we'll be able to send to each of you because we've got your email addresses since you had to register to sign up for this program. So we can share this whole slideshow with you after this meeting. If you'd like further information about the organizations that are part of the Haiti CPR Consortium, we've got the web addresses on this slide, or you could also contact me. You've got my email address here as well as Teresa's. And that's about all that I've got to say for now.
Thank you, Sue. Thank you so much. In case folks are furiously making notes, you should know that we will be providing everybody with a copy of this wonderfully organized presentation that Sue just made. I'd like to take a moment now and just introduce another one of our partners, our partner on the ground in Haiti, Smallholder Farmers Alliance. We'll be hearing from both of the co-founders, both Hugh Locke, president and co-founder of the Smallholders Farmers Alliance in Haiti. He's an author, also the co-subject of the documentary Combit, the Cooperative, and frequent speaker at forums as diverse as TEDx, the Said Business School at Oxford University, the Clinton Global Initiative, the Parliament of the World's Religions. He also writes a popular newsletter blog that aims to interpret the complex state of current affairs in Haiti for an international audience. He's a member of the Baha'i Faith and early in his career was director of the Office of Public Affairs for the Baha'i International Community. His co-founder, and I like to call him General on the ground in Haiti, Timothée George, was born there in 1978, studied natural resources and peace at the United Nations mandated University for Peace in Costa Rica. At UPeace, he co-authored the book, The Fabric of Community, with Earth Charter staff members. In 2002, he joined the Haiti presidential program, Alpha Economic, a literacy campaign alleviating socioeconomic deprivation in the rural areas of Gonaives. Since 2008, Timothée has been deeply involved in environmental rehabilitation, natural resource management, community capacity building, among other topics. In 2012, he co-founded the Smallholder Farmers Alliance, a Haitian community-based grassroots organization. He lives in Haiti, and his dream is to help create sustainability for an ecologically safer world. So Timothée and Hugh, it's with you. And unmute yourselves.
Hi, everyone. And it's a really great pleasure to be part of this effort. And when SFA first involved on this Haiti CPR project, we thought we would be able to get doctors travel to our remote communities. So at the end, it was not possible. And we actually changed, and the alternative was for us to organize distance training for the community leaders. And so far we have done five community distance trainings, and also we were able to hire a new coordinator, especially for this project, and who is the help, one of help alumni. I think Mr. John Antoine Godinson is here with us, and he will be pleased to speak more about what are the steps to get a community training. So please, Godinson.
Hi, everybody. Thank you for the opportunity. My name is Godinson. I'm very happy to be working with all the organization, that make up Haiti CPR. I am now planning to launch the next COVID-19 distance training for the coming week, and we plan to do 9 of these training. But we have around 6 steps involved in the training. So the first step is to meet the community leaders either face-to-face, by phone, or via internet. We have Skype, Zoom. This meeting will allow us to have a chance to explain to the project how the project works, what to expect from us and what not to expect. Because as we know, there are many things that we can do and many things we cannot do. The step 2 is to explain to the leaders the responsibilities they have when they get the training. So they own the project, they own the decision, to go out to the communities and help save lives, and how we expect them to have a role in helping the community to prevent the coronavirus. And step 3, we schedule the training with both the community leaders and carriers a few days in advance. And in step 4, we take or arrange for a brochure to get to the community. And for some of the communities who are far away, we'll make arrangements with them. And this brochure has basic instruction on preventing COVID-19 that the carriers doctors will go over. And in step 5, we do the training. So the training is being done on the dates that were scheduled. And step 6, we stay in touch with the community leader, and we do follow up with them to make sure that what they have agreed upon, they are following up on it. Thank you.
Thanks, Godinson. Godinson's only been on the job for like 4 days, but he's already a force of nature. So we're very grateful.
Yeah.
As Sue mentioned earlier, we've already done 5 distance trainings. We're about to do 9 more. And on the basis of that, it's really a work in progress. We don't exactly know how we're going to be able to move forward. We know that we're going to continue distance training, but there's a lot of details still to be worked out because nobody's done this before. So we're learning as we go along. But approximately the beginning of the week of May 18th, we hope to have pretty well defined what distance training involves. And so additional groups in the United States or Canada that have partner organizations in Haiti will be able to give you details as to exactly what would be involved to get your partner organization in Haiti signed up for this distance training. So this is a message we're sending out to Catholic parishes, to Baha'i groups, to Episcopalian churches, to Protestant groups, and frankly, NGOs in the US or Canada that may not have any religious affiliation or faith affiliation, but that are helping to support their counterpart in Haiti. So there are 4 basic things that we're suggesting that all of you in the position of being in a North American organization with a partner in Haiti, what can you do to assist your counterparts in Haiti to respond to the coronavirus? Step 1, and this is all outlined on the Raising Haiti website, which you'll get access to in the follow-up. But option number 1 is to encourage your partner organization, your counterpart in Haiti, to sign up for the COVID-19 SMS WhatsApp alert system, which is being operated through the CARES Foundation. Many people have cell phones in Haiti. They're not all smartphones, but a very wide distribution of cell phones. And so get them to sign up. It doesn't cost anything, and then they'll get regular updates on what's happening. And that's Dr. Nat's organization, CARES Foundation, which supports 168 hospitals and clinics throughout the whole country. The second thing you can do is to help distribute the basic coronavirus brochure that was mentioned before. So that's this one. So with the action characters on the front and details about the coronavirus on the back. And any organization can apply to get additional copies of this brochure that you can in turn have your counterpart organization collect from one of the CARES Foundation locations around Haiti and then distribute to the community. And the details for getting additional copies of that brochure are available on our website. So that's action number 2. By the way, action number 1 and action number 2, total cost 0 to both you or your counterpart organization in Haiti. The third action you can do and encourage your counterpart to do is to get coloring pages where this particular character and the different scenarios that are inside the brochure, which help through comic characters to present lessons like distance, social distancing, wearing masks, etc. Those have been made into single sheet coloring pages, which you can give to kids. It both helps them learn more about the issues, but at the same time have something to do while they're homebound and unable to go to school. So that's action number 3. And again, that doesn't cost anything. And the way to apply to get those, the physical copies of those pages, if you're not able to download them or your counterpart is unable to download them in Haiti, you can get physical copies of those by filling out the form online that's you can get through a link through the Raising Haiti website. And then lastly, we are obviously doing the distance training, and you've learned a lot about that. So that's an overview of what we're setting out to accomplish with all of the partners around the table and with the support of both Raising Haiti and the Julie and Grace Foundation. Thanks.
Thank you so much, Hugh and Timothée and Godinson. Our next guest is Connor Bohan. Connor is the founder of the Haitian Education and Leadership Program known as HELP. He lived and worked in Haiti from 1996 to 2008. Under his leadership, HELP has grown from a single student to the largest university scholarship program in Haiti. In addition to growing HELP, Connor was a volunteer teacher, deputy director of the National Democratic Institute in Haiti, and Director of Haiti Programs for the American Institutes for Research. Connor is an Ashoka Fellow and a Fellow of the RSA. He has a BA in History from Brown University. And I just have to say personally how wonderful it's been to work with Connor and to understand the extraordinary leadership capacity and capability that his program is inculcating in so many young Haitians. In fact, Jean Godinson-Antoine, who you just heard a moment ago, who is the COVID-19 coordinator on the ground, is an alumni of that program. And we believe that shortly a number of his compatriots, also alumni and students of that program, some of them we hope are online with us here today, are going to be joining this effort and really leading the charge in moving this process along. So Connor, it's wonderful to have you. Welcome.
Hi, everybody. Thank you, David. Thanks for inviting help to join the Haiti CPR campaign. Thanks to Hugh and Mary Sue and Teresa, and of course, David, for putting this initiative together. And thanks to the Julie and Grace Foundation for funding this important campaign. Yes, very briefly, helps a university scholarship and leadership development program. Our mission is to create a group of young professionals who will work for a more just society in Haiti. As a couple people have mentioned, Godinson is one of our graduates. There's Dr. Theo Jean-Baptiste is regional director for CARIS, and he's another graduate of our program. And I see a few other graduates of the program in attendance. We have about 225 graduates. We've got about 150 current students. And essentially our role is to allow our students and graduates to help as much as they can in this effort, seeing that it fits perfectly in our mission, which is putting our students and graduates to work in the service of those many Haitians who are less fortunate and not have access to the same opportunities that our students have had access to. So that's really it. It's a great opportunity for us to engage our students and graduates in making a real difference in their communities. And so want to thank everybody for allowing help and the students and graduates this opportunity to practice what we preach.
Well, it's we who are thanking you, because these extraordinary young people coming to this charge give us all a sense of confidence that we can really make a difference in this process. Thank you so much, Connor. The next guest that I'd like to introduce has really become one of my personal heroes. I'm going to embarrass her if I say it, but Teresa Patterson is the co-founder and executive director of the Parish Twinning Program, of the Americas. They have facilitated and maintained over 300 linkages between Catholic parishes in the US, with over 225 parish communities in Haiti and 48 in Latin America. She's also the founder and executive director of the Visitation Hospital Foundation that operates a large clinic in Petite Rivière de Nips, Haiti. And their program really now for almost half a century. I know that we have a lot of parish twinning affiliates on the program with us here today. And we're really so delighted to introduce you, Teresa. Welcome to the chat. Welcome.
Well, thank you for that introduction. And thank you to all of you for participating in today's Zoom chat. A special thank you, as Sue said, happy Mother's Day to all of the mothers who are with us. This is indeed an unprecedented time for all of us, a time of uncertainty and urgency. It is also an opportune time for us to work in concert and solidarity with the people of Haiti and our sister parishes in preventing the spread of the coronavirus. An important part of PTPA's mission is to support you in your work on behalf of your twin parishes by sharing resources and knowledge about effective solutions. And our collaboration with the Haiti CPR Consortium is an example of finding ways to accomplish this. We are particularly grateful to David and Sue for inviting us to join them. And we thank all of you who have participated in the pilot project. We hope that those of you who are listening will also join in supporting your parish or community. And we'd like to encourage you to consider providing resources to accompany your community committee in their efforts to mitigate the spread of COVID-19. No doubt we will all learn from this experience and this pandemic, but please know that PTPA is here to accompany you and support you throughout this process. Thank you.
Thank you so much, Teresa, and thank you for all that you've done for so many years. You know, it's been an extraordinary several weeks, I think, coming together with so many different organizations. And there's a, you know, as challenging as this time is for all of us, and especially for the people of Haiti who are really so exposed with so few resources to help. There's been also, I think, a movement that is really quite extraordinary. We're hearing more and more folks basically saying the same thing. I think what COVID-19 is showing us is we really are one. And the very survival of our species on this planet is conditioned on our breaking down the illusory divisions that we have constructed over the ages and joining together to solve the many problems of the age, whether COVID-19, climate change, food insecurity, poverty, homelessness. It's endless. There's no problem, though, that we can't solve once we realize that we are truly in this together. And before we close with a prayer, I'd like to just make a couple of announcements. We, at the last minute, were surprised with a gift, a song that speaks to this sort of theme of oneness. And I think this is kind of our anthem going forward. Gifted for this growing movement, and there will be more of these sessions by composer, producer in Canada, Jack Lenz. And the title of the song is We Are One in This. And we're going to share that after the closing prayer. Out of respect for everybody, we wanted, and it's Mother's Day, we wanted to keep the program to under an hour, which we are able to do by eliminating the questions and answers. But we will have a session after the prayer and after the song, which you can enjoy or leave as it's playing, whatever is good for you. But for those who want to take action and need some more personal attention, for those who have some questions, several of the panelists are going to stick around, and right after the song, we'll try to find our way through the technology and figure out how to field those questions. We'll be able to do that. But you know, thank you so much for you know, for coming, and we will be following this up with another program in 2 weeks. You can learn more at Raisinghaiti.chat, or as you see on the screen, or Raisinghaiti.org, either one of those two. So for those that are leaving, thank you so much for being with us, and we look forward to connecting with you again. And for those that are staying, we'll be here in just a few minutes. And to close out, I'd like to introduce Father Tom Clegg. He is the president of the board of directors of the Parish Twinning Programs of the Americas. And we're so honored to have you here with us, Tom, and please share the prayer that you have.
Thank you, and thank you all for the opportunity to partner with you in this as the president of the board of PTPA. Let us pray. May we who are merely inconvenienced remember those whose lives are at stake. May we who have no risk factors remember those most vulnerable. May we who have the luxury of working from home remember those who must choose between preserving their health or making the rent. May we who have the flexibility to care for our children when their schools are closed remember those who have no options. May we who have to cancel our trips remember those who have no place to go. May we who are losing our margin money In the tumult of economic market, remember those who have no margin at all. May we who settle in for a quarantine at home, remember those who have no home. During this time, when we cannot physically wrap our arms around each other, let us yet find ways to be the loving embrace of God to our neighbors. Amen.
Thank you so much for that. And as we said, there'll be a brief intermission now. It'll be a close for those who care to leave. And we'll have this song. And then right after that, we'll try to field some questions and take some time to dig in.
This I wish for you, to live in unity and peace. This I wish for all of you, to be as waves, waves of one sea. This I wish for you, to live in happiness and love. This I wish for all of you, to be as flowers, flowers of one garden. We are now all global citizens, citizens of one world. This is the time for love and unity, justice, all for peace. We're all one in this. We're all one in this. We're all one in this. One world, one world, one world. This I wish for you, to show us fortitude and strength. This I wish for all of you, to be as stars, stars of one heaven. We are now all global citizens, citizens of one world. This is the time for love and unity, justice, all for peace. We're all one in this. We're all one in this. We're all one in this. One world, one world, one world. We are all in this together. No borders do we see.
don't know if Jack is on the line here or not. There are a lot of people here, but if you're here, Jack, what an awesome anthem and what a wonderful gift. Thank you so much for that. And so it looks like the overwhelming majority of folks on the call have stayed on with us here. And there are some questions. You can write your questions in the chat. We'll try to go through some of them, and whoever is the appropriate one to respond, please just open your microphones. Maybe we should open them all so that we don't have this problem with unmuting ourselves. But I have a question here, maybe for Godinson. Is there a local Haitian phone number parishes can call? Many don't have email availability. Godinson, do you want to give out your number? Are you comfortable with that? You are on mute. I'm trying to unmute you here. Oh, there you go. Welcome.
Welcome. Sure. Yeah, I'm readily available on my phone number is 509 for 3669 5819. 3669 5819. I'm
wondering, Josefina, if you might post that in the chat for everybody. Say it for us one more time.
3669 5819.
We've got some. Have you got that, Boyd or Josefina, that you can post?
I will post it shortly.
Okay, very well. Keep your eye on it, Godinson. If we missed a number, you'll let us know and we'll fix it.
I will definitely. Thank you.
Here's a question we think is directed to Hugh and Timothée. Does the consortium have a partner on the field with the capacity of making reliable masks? I know MFL has helped making some through Sakala, and Electra is a Haiti company that produces them locally as well, just in case you're looking for partners. Any thoughts, Hugh? You're on mute. No, you're not. Oh, you still are. Hold on. There you go.
Okay. Can you hear me?
Yep, you're good.
Masks is a challenging issue right now because the government received their first shipment from China, as you may know, and that arrived, I think, 3 days ago, of PPE. And part of that shipment was apparently a large volume of masks. And so what isn't clear yet is how those masks are going to be made available to the public, and whether they're going to be distributed for free. Meanwhile, there is a project that is working with local tailors and sewers in Haiti. It's called Coud Combit. And that's producing masks at approximately $1.60 US per mask, but that price depends on volume purchasing. So I'm not quite sure what the volume level is in order to get that price, but those are being produced now. The person who is directly responsible for that is Magali Noel Dress. If you don't know how to reach her, you can send me an email and I can put you in direct contact with her. And then Nat, do you know anything about Dr. Nat, availability of the government issued masks? Are they available now? And if so, how does one get them?
Thanks, Hugh. Yeah, no, they're not available in the sites. So my hospitals and clinicals and Ministry of Health sites are not getting them right now. So I don't know what the plan is for the distribution.
I guess there is a question, what are they doing with them? But anyway,
yeah,
if you go there.
Yeah, I can find out, but I highly doubt they'll be for the general public. I think they'll be restricted to clinical sites. Yeah.
So part of what is being explored right now through this group, Coud Combit, is they've lined up all of these sewing groups around the country, thousands of individual independent sewers, but they depend on being paid in order to produce the masks. There's a large volume of fabric has been donated, and so they're ready to begin production, but unfortunately that means that somebody needs to pay for them. So, you know, it's it's a work in progress, and I can't tell you exactly how that's going to play out. What we're trying to do through Haiti CPR is monitor the situation, and as we begin to work with the additional distance training projects that Sue and Goddenson outlined, we're going to find out, at a community level, are they willing to actually make their own masks and just find bandanas and wear them? Or do we need to think through the process of maybe making a bulk purchase for a number of masks? And if we did that, where would the funding come from? And those are questions we can't answer yet, but we're staying open to all those possibilities. And then the best scenario would be that the government puts their hand up and says, oh, we've got 500,000 masks. How would you like them distributed? Don't hold your breath on that one.
And I'll just throw out, we did not want to have this event really be asking folks for money, because we know that the churches are struggling. We know that people are struggling. But if there's anybody on the call who's got access to resources, 100% of all contributions made for COVID-19 is passed directly to SFA to acquire, to do whatever, as we're learning all of this stuff on the ground. No administrative fees are being taken. Everything is 100%. So, but moving along, we've got a lot of questions here. The next couple are for you, Nat, and you may have answered the first one. What's the situation with ventilators in the country, and how is the nursing staff, the number of nurses and hospital personnel, how does it look in the country?
Thanks. So the number of ventilators, I think, is around between 60 and 80 functional ventilators in the whole country. So we're 11 million people. The problem with ventilators is that even if we do get a whole load of more ventilators, we don't have many people who are trained to use them reliably. And most of the centers, are not able to look after ventilated patients just because of electricity, unreliability, lack of oxygen, lack of, other diagnostic equipment that you really, really need. Reliable x-rays, for example, to check the tube is in place. So I don't think ventilators, getting a lot more ventilators may not help us in the short term. The BiPAP machines or the CPAP machines, these are kind of less invasive modes of ventilation, relatively cheap to buy, relatively easy to operate. So we've bought 100 of those, but again, 3 or 4 weeks, but that is still not significant. So we probably only have 100 in the country functional right now. So those kind of things we would like, and we're able to train people on how to use those machines relatively easily. Other things are, really the oxygen generators, again, about $2,000 to $3,000, a small, like a portable air conditioning unit, just plugs in and can generate, can concentrate oxygen from the air. Again, those machines are very, very useful, and we've ordered about 200 or 300 of those coming in. But they're going to take time, and a kind of a more sustainable technology for Haiti, basically. So, but staff-wise, we have adequate staff to work. Most of those staff do not have the PPE to work. A lot of staff are scared to report to work. I don't know if you've heard, there are lots of the communities are very, very scared as well. And this is something that the parish association could really help with, and the faith communities can really help with, is to really decrease stigma, teaching our congregations that this is not a curse, not a voodoo or a black magic, but this is just an illness that we all have to be compassionate for. And we've had communities threaten to burn hospitals who are receiving COVID patients. We've had communities trying to block COVID patients from entering hospitals. And this is something that the faith-based communities and the Small Farmers Association, other kind of community existing groups can really act on, because it's beginning to hamper us now.
Thank you for that. A couple of quick things. We have a question. If folks are free to share this recording of this chat with friends of Haiti when we get it, the answer is absolutely, certainly, far and wide. And again, we'll be back here in 2 weeks. So, keep posted on our website, Raisinghaiti.org or Raisinghaiti.chat. We have an interesting comment here that if you could capture it, Josefina or Boyd. Unlocking Communities is in the central part of Haiti with COVID material. We're also available to help train. We have water filtration systems, hand washing buckets available upon collaboration. We do microfinancing to help families afford systems and work with multiple parish twinning programs. Please email if you want to connect with them directly at josh@unlockingcommunities.org. That's Josh, and it's in your chat. Josh@unlockingcommunities.org. And perhaps we want to explore that, Sue and others. Here's a question: will there be cost? And the answer is it depends. There are a lot of free assets on the website. We want to try to bring as much to the table that doesn't have a cost. And we're still building the website right now. I mean, literally every night it's been under construction. But you can still access it. We make sure it's available. There may be some things that say under construction, and just bear with us on that. But and yes, we do expect that some of these assets will cost, and hopefully the groups that are involved with various communities will be able to help with that. Or it's interesting, this process. We've had 3 grants offered to us that we didn't even ask for. This just doesn't ever happen. I'm telling you. So I feel like the resources will be coming. Here's a comment: extreme violence has, prior to the outbreak, taken hold of our community in northeast of St. Mark. Is there any indication that this has abated? We cannot initiate any training with fear of violence in the streets. I don't know, is there anybody on this chat that can answer that?
I think the violence is not, it is kind of sporadic. It's not a kind of lockdown country that we had a couple of months ago. So, I don't see any real problems to try to continue these trainings. And, if we see on one day that it's not possible to do a training, then the people just won't turn up. But I don't see any, right now, reason to stop a community mobilization in a safe way. As long as we do it without increasing the risk of transmission, I think that's the most important thing. But we face these small issues on a day-to-day basis in Port-au-Prince, the Gonaïve area, Kai, but I think we're not at that complete country lockdown stage now.
Thank you for that. Here's a question. I think I could just answer it quickly. What are the deadlines for recruiting and joining the program? We don't know. It's based on, how many communities arise to want to engage with us. And we know there are other groups out there that are doing wonderful work as well. But as we said, it's first come, first serve. There's a form that needs to be filled out. You can access it at our website, Raisinghaiti.chat or Raisinghaiti.org. And it'll be, first come, first serve. And we may, have to get back one-on-one with folks and say, no worries, we're going to do this. Or, there might be some cost for this or for that component that you might want to have. I hope that, I don't know if anybody else wants to say anything about that.
Just one thing. So the form is not on our website as of right now, but if you send an email to me or Teresa, we can send you the form. We're trying to load it on our Facebook page as well. And you will be receiving the slideshow. We'll be emailing that to you, and you can get the form off of the slideshow.
And correct me if I'm wrong, Teresa, but that form went out to all of the leadership of the Haiti development interests of the various churches in the PTPA program. That form was sent with one of your emails, if I'm correct. Is that right?
It was. Actually, we just sent it to the 18 pilot project parishes. But I certainly can send that out to everyone. If any other parishes are interested in joining, that's not a problem.
Well, I think
remember,
they would just send me an email. That would be good.
Just remember, when you send those, give us a little time, because we have to finish the next 9 trainings in order to get ourselves fully operational and know what the range of possible costs are, because we don't know that yet.
Yeah, and just from the Parish side, we will always provide the training for free, and we can carry on for as long as need be. So there's no problem on our side.
Just Nat, some of the issues that we're discovering, like when we go into a community and we have to bring masks, some masks to start with, but then the 10 people who receive the masks, who are then going to go into their own respective communities, are saying to us, so what do? We can't go in without masks. And then they also are saying, it'd be good to bring some food if we're going to do this because people are so desperate. So we're trying to just balance all these things out and come up with, maybe it's a menu of options. We don't know that yet,
Yeah.
We know that from your side, you're never going to charge anything, but we're just trying to figure out, in order to set that up and facilitate it, what's the bare minimum that's still respectful of the local communities, and then what are the additional elements we could possibly bring to the table that might have a cost.
There's a rather detailed explanation with some suggestions by Dr. Letitia Shea. Are all participants able to see what's the questions in the chat? Can somebody answer that? Boyd? Well,
They
I'm
should
going to
if they have it up.
ask Nat, take a look at Letitia Shea's note if you get a minute. And,
I'm in the chat section, but I can't see questions. All I can see is.
Okay. Well, you know what? I'll just read it. It looks like it just disappeared. I don't know what happened here.
Go under answered.
Pardon me?
Answered, is it?
Yeah, I just put it under answered so that everybody could see it.
Okay. It's under answered. Okay. So does that mean everyone can see it, or just the panelists?
Everybody should be able to see it now.
Okay. So at the bottom, or toward the bottom of the answered section, "Prevention is Key" by Letitia Shea. Just take a look at that rather than reading it.
I can't see it. Sorry, I honestly can't find it. If I go to more,
I probably could have finished. As my wife would have told me, just go ahead and do it, David. You could have finished it by now. Let me do it really quickly. Prevention is key. So thank you for the distance training. 2, isolation of ill patients is needed. Maybe open schools so rooms can be used to house those that are recovering from COVID-19, or conversely, isolation of those at risk, such as elderly, sick members in schools might work. In your teaching, you may wish to include information that treatment of COVID-19 includes encouraging people to lie on their stomachs, prone, or their sides, and not flat on their back to improve recovery. Finally, oxygen concentrators with nasal cannulas or masks at each clinic or PTPA site could be key to helping at least a few of those with moderate or severe disease. So thank you for that, and we're glad to share that. One of the things we realized in this process is we want to be very clear. We don't, as a consortium, really have the resources to deal with more than what we're trying to do, which is prevention. But of course, all of these things are important, and we're so glad to have Nat with us, because he's going to be on the front line, there's no doubt, with what's coming in the next few weeks.
Also,
so,
just to point out that on the brochure that's being had, that we developed, that's this brochure that goes out as part of each training. On the back is a number that anybody in Haiti can call and get detailed advice on follow through, because we're not able to provide that. As David said, we're just helping in the prevention part. When it gets into anything with regard to treatment or follow-up, that has to go within the healthcare community.
Yeah. Just to quickly answer that, all of the sites that we work with, and actually most of the big sites in Haiti, have got isolation and triage plans already in place. And with the thought of using schools and churches that are not open right now to have mass casualties, mass treatment centers, we're not seeing huge amounts of cases right now. So thankfully, we don't need to do that. But they all do have that plan of action. The nasal cannula is great, but we just don't have any of the machines. We just don't have them. So we've ordered them. The government have ordered them. but we're waiting for those things to arrive. In my 160, 170 hospitals, we only have 2 hospitals that have those things before COVID. And by the time the COVID thing broke out, it was taking a long time to procure those things from Europe and China. So yeah, all of those are great ideas. And then in the brochures that Hugh has mentioned, we talk about social distancing, and if you have symptoms, to stay at home unless they get worse, and then also to call these numbers. So a lot of that prevention messages in the brochures that are freely available for people to download and print.
I'm really glad that you mentioned that. I want to just say one thing. That brochure with the Tanama character, this incredible superhero after the fashion of Wonder Woman. Thank you for that. I don't read Creole, but you can look at the brochure and get totally, she's battling the arch enemy COVID-19, and you can see the things: washing your hands, wearing a mask. And I think that, folks should deploy that. You can get that right on our website. They can be printed. We're also going to be printing, many of them and taking them into communities. Here's a question. Will our group only work in rural areas? That's a good question. I think our focus, smallholder farmers and Raising Haiti, has been, the often forgotten rural communities of Haiti. But maybe we should ask Teresa. I'm sure that there are twinning relationships in less rural areas, and I assume we would be open to working with anyone who, where it can be made to work. Teresa?
Well, primarily our twinnings are in the rural areas, but we do have a few in some of the larger cities, but minimal. And so we really are in the rural areas also.
And I would suspect there are more resources in those cities for these kinds of things than there would be in farther flung areas. Hugh?
Well, and that's the point, that rural communities are so completely forgotten in Haiti in terms of support. And so in every case that we've done our initial trainings, we're the only people to show up to provide any kind of direct service to those communities. And I don't think that we're going to find many other locations where we go where someone else has come in to provide this service. So I think it's a really critical thing. And to be able to be an extension for the Caris Foundation to reach those more remote areas is something that I don't think anybody else is doing in quite this way at the moment anyway.
Yeah. And just to say that the comics are available in Spanish and English. So if those other twinning parishes in Latin American countries would like to use it, we'd love for them to use it. And the English versions, I don't know whether they're up on the website yet, Hugh, but they just got completed this week.
Yes.
I did not know that. I would love to see a copy. I've been wondering how to read it. So that'd be great.
Well, and just to say that, if I may, the whole campaign that we've developed with the Caris Foundation, because Caris Foundation has created all of the messaging, and then working with the Haitian comic book artist, Tony Louis, we've created a national campaign, which it takes the form of the brochure, which has 4 primary messages about social distancing and isolation and things, washing your hands, etc. So those 4 key messages have been turned into individual social message images, which are going out through WhatsApp and Instagram, etc. And then there's a series of posters that have been made from those 4 messages. We're just in the process of preparing to develop radio spots based on those 4 messages. And the video called the Tanama Challenge will be issued tomorrow. And so that's an animated version of the Tanama character who washes her hands, puts on a mask, and then tosses the soap off screen. It's frankly very cool. And then a bunch of well-known Haitian celebrities in turn each catch the soap, wash their hands, put on a mask, toss the soap to the next one. So this is, celebrities like Izolo, who's the top rapper in the country right now. Between them, the first 5 people in the first video being issued tomorrow. Between them, they have over 6 million followers on social media. And so the Tanama message that we developed with Nat and the Karis Foundation and with Tony Louise creativity is going to reach an unprecedented level of media saturation in Haiti, just at the point where it's necessary.
It's really, really, really wonderful. Here's a question for Godinson. If you can, let me just see if I can unmute you while we're doing that. This is from Patricia Dillon, and she's asking, when can the leaders who are signed up expect a phone call? They've been waiting, and we appreciate everyone's patience, but guidance, and give us a, I don't know if you've heard directly from Patricia, but give us an answer.
Replying to Patricia, and let me confirm if Patricia is a local, but I have contacted everyone on 9 parishes that we received, that were signed up, and have an initial brief of possibility if they are ready to receive the training. Among the 9, I think I have not been able to reach 4 because of they are not available on the phone or any reason, but 5 have been contacted and have confirmed, and I will have to make a follow-up call to make sure when their training will go. So from our side, we did the initial call, and we will continue to do that. If they can call me, it's let me confirm location I have not been able to reach. It's like Our Lady of Guadeloupe with Notre Dame de Fatima, Bassinzim, Coq Chanté of Jacmel. I've not been able to find Saint Joseph Parish in Pendu, Gonaive, and Saint Agnes Beaumont.
Thank you. Here's a question that's it's not, I don't think, quite related, since we don't have vaccines yet for this, but someone is writing that our parishes in Gonaive have been getting anti-vaccine cell phone messages. As a result, attendance at immunization clinics are down. Is this a problem elsewhere? Any idea where it's coming from? I don't know if you want to take a minute, Nat, and respond to that, or we can move on. You're on mute. Hold on. There you go.
Yeah, this is a widespread myth that we're seeing right now, that vaccination is, people are being vaccinated and then falsely given the virus. So this is a widespread, in all 10 departments, myth that is going around right now. So we're trying to combat that. And I think the radio slots, and I think the work with the faith-based communities is a really powerful way of unlocking those kind of messages, or demystifying those myths. But it is a prevalent myth that we're seeing everywhere.
Thank you. Here's a question. Back to the brochures. We may have already answered this. There are a lot of questions, so we'll keep this moving along quickly. But are quantities of the brochures and coloring pages available for communities, or is it that the master copies are available for communities to print themselves? Maybe you could just real quickly, Hugh, cover that one more time.
If you go onto the Raising Haiti website, go to the free resource page, you can then apply to the Karis Foundation to get copies of both the printed version of the brochure and the printed versions of the coloring pages. And there's an option to make a donation if you can afford it, or if your local community can afford it. If not, there are certainly numbers that are available for free, but there's going to be a point where they can't do it for free. But it's there, and Karis has different locations in Haiti where they can be collected. So you go online, make the request, give the number that you want of each, and then you'll be contacted to say, yes, they're available, and where would you like to pick them up? They can't deliver them, but there are a couple of different locations where they can be picked up. Am I conveying that accurately, Nat?
Yeah, I guess, yeah. We have 10 offices that in all 10 departments of should be able to pick them up. And I guess, Hugh, we have a limited budget to print those out. So, once the money's gone, it'll be gone. But, please, there are lots of, the printing stores in Haiti are all open, and it costs about, 1 to 2 cents a double-sided page to print those out. Xerox can do that very, very easily. So the costs are not prohibitive. Yeah, I just hope that people are able to use this. And, they print on a letter-sized paper on a normal printer. So it can be done on a very small scale way. But yeah, we will be happy to print those out until our money runs out.
So following up on both of these comments, just, again, we did not want this to be about money. We wanted to bring information and do as much as we can with a generous grant that we've had and not put pressure. But, this is an evolving hour-to-hour situation. I think, anyone who can, whether it's through Parish Twinning, or whether it is through Caris or visiting our site, again, anything, that is earmarked for COVID-19, there are no admin fees being taken, and everything is going directly 100% on the ground throughout rural Haiti to try to do as much as we can. So, we're not asking, but that's a soft ask. Is there an organization able to facilitate shipping PPE supplies to our partner cities?
From where?
Yeah.
Well, let me just say, unless you've already been involved in shipping things from the supplies from the United States to Haiti, I would suggest, this is personal, don't do it, because the point at which it arrives in customs and you haven't made the proper arrangements to have a receiving entity that has an import license, then you basically won't see the stuff. So never attempt to send anything to Haiti, however well-intentioned, unless you have done it before and you've been able to successfully get it through customs. Because otherwise you're just asking for, you're asking for trouble.
So we have so many questions here. I'm going to have to do something I didn't do at the beginning, and I really don't want to do. I'm going to have to, sort of make some selections. One quick request that perhaps Sue, our team, can just make this happen. They're asking for a copy of that of the prayer that Father shared at the end, and I know you have access to that. So maybe when we deliver any other deliverable, we could do that. If anybody particularly wants one soon, you can email Sue Carlson. You have her email address that's been posted, and we can post it. We could post Sue and Teresa's email addresses again in the chat box for folks.
That prayer is going to be on the slideshow, and we can share the slideshow with everybody who signed up for this this seminar.
Okay, very well. What will be the focus of the program on May 24th? It's really going to be an update, and we are scrambling in the next week or two. I think Hugh talked about this, that we are, Godinson and his evolving team will be working on as many trainings as possible. We'll be learning more there. We'll be learning more from Nat in terms of the spread of the disease. We'll probably have some other assets to share, and we'll keep you posted. I hope that answers that. Anybody else have anything they want to say about that? Here's a suggestion on masks, a way to help small communities, simply to identify the seamstress in that community and pay them to make masks. We've done this in remote communities served by LIDE. This is Catherine Adams, the executive director of LIDE. Welcome. I hope you're still on the call. One of our partners. So communities served by LIDE in order to bring incomes to women who've lost so many other possibilities for work. Hugh, I know you're working on a program similar. I don't know if you want to say something about that quickly.
Well, I mean, part of the challenge is being able to identify sewing ateliers and sewing groups, and the system that I helped to launch, but which I'm not continuing to be involved in because I don't have the bandwidth. But we set in motion something where these existing individual independent ateliers that Catherine is referring to, they receive pre-cut bunches of masks, of the material for the mask, along with the instructions. They then have to guarantee that they're going to themselves wear masks and not be in groups of more than 10 when they make the masks. Then they bring them to what we call a regional hub, and then they have to inspect the masks, make sure they're up to the right standard, and then they pay the individual sewers who've sewn them. So right now, there's a network of several thousand of these, and I think, frankly, that they're at their maximum capacity to I don't think they can take any more sewers at this point. But it's also long-term going to help to revive the cottage industry of independent sewers, we hope, post-COVID-19.
You know, there are some really fantastic items on this chat. Josefina, let's make sure that all the panelists get to see this, because there's some really good ideas. I don't think we need to talk about all of them here, and we don't really have time to do it, but be assured if we haven't answered a question or shared something, let's have the panelists have access to this really good information. Here's one, just Linda Haas writes, papillon, I'm probably not saying Papillon, okay. In Port-au-Prince is planning on making masks to sell. I don't know where they are in the process. I'm willing to inquire about the status and also see inquires about how we might support that effort. So let's look at that and make our way through that. And here's another one from Unlocking Communities, offering to help train and serve as a distribution point for flyers. That's the same Josh at Unlocking. Can we recommend a strategy for approach to people with presumed COVID-19, instructions on isolation, quarantine, should tents, facilities for prior cholera outbreaks be used, capabilities for hospitals to intervene effectively in the course of the disease? Again, I think this is something for Nat. And
the cholera tents are generally in such a bad state right now. People are dusting them off and finding them they're pretty much unusable. So where they are usable, people are using them, and where we're identifying other spaces such as unused schools right now and community centers, we're using those too. But good idea.
Yeah, and there's more here from Dave Schmidt. I'm not going to go into it, but I think, again, for anybody on the call, Karis is the point of contact. I hope I'm okay saying this, for anything beyond prevention. Hugh and Nat, is that right?
Well, I would say that the first point of contact is the government issued number that's on the back of the brochure. And that's, they've set up a hotline, they've staffed it, and they're ready to field these questions rather than going through the Karis Foundation, which is a support network to hospitals and clinics, if I'm presenting that correctly, Matt.
Yeah, thanks, Hugh. Yeah, the helplines actually work really well. I've called them and tested them myself, and people do pick up. And if you hang up halfway through, they will call you back. They're free to call, but we know people, not everybody has access to mobile phones, but the service is actually pretty reliable. And if you have any questions or suggestions, please don't hesitate to email Hugh and myself.
Hugh, can you say that number out?
It's 2020 2020.
That's within Haiti.
Within Haiti, yeah. Within Haiti.
Another one, I think, for you, Nat, you probably know about this, but it's good to know, not really a question. I'm sitting in on behalf of my father, Rodney Harrington, founder, CEO of Aqua Research, based out
I know Rodney very well, yeah. Rodney,
the company is mainly focused on water sanitation, he says, purification, many systems in place already in Haiti. We're working with Karis, and whatever help we can offer, do not hesitate to contact us. So that is Aqua Research.
Thanks.
In Albuquerque, New Mexico.
So we're buying some of those machines from Rodney, and in the future, when those machines arrive, we should be able to produce bleach for all of the parish twinning networks very, very easily. So that bleach can be distributed to the parishes, and the parishes can, have their congregations use it to clean, their houses, but also sterilize drinking water. So that's something that we'd love to investigate with any of you partners when those machines come in about 2 months' time, unfortunately, to make.
That's great. Sue or Josefina, could you just take a quick note? We have another note back from Josh. He's thanking us. He would love to talk. Organizations can also call Unlocking Communities and his name is Josh Koralski, and his phone number is 630-303-7259. And that was a group that said that they would be willing to help even with trainings. Heard that there's a shortage of doctors in Haiti. Will there be enough doctors to take care of patients if the outbreak really spreads around the country?
Yeah, I don't think we're going to be limited by doctors. We're going to be limited by the ability to treat patients with oxygen. So, the nurses, we have nurses and auxiliary nurses. We are understaffed, that's true, but, that's something that's very, very difficult problem to solve. But we're going to be limited way before that by the equipment that we have to treat severely ill people. When we run out of oxygen, there'll be nothing that we can do when, to help to assist people. So we'll run out long before we run out of staff.
So here's a question: if there is a connection for masks to purchase, again, follow our site right now. I think you've said, it's really limited, but we're scrambling to see what we can bring to the table here. Someone is asking, and I don't know if we can answer this, Josefina or Boyd, maybe you can help us. How many people in communities are viewing this? It would be interesting to know. I think we had approaching a couple of hundred on the call. Are there any stats on Facebook live streaming? It's okay if you don't have it at the moment. You can chime back in any moment that you do. How can USA parishes with a Haiti twin best help our sister parish? We're not able to send anything on the C container yet. Is it better to make a financial contribution? If yes, to whom? I hope that person asking the question is still on the call. The answer would be yes. I mean, it would be great to do that. And again, whether it's in a particular community or not, as we know, COVID-19 has shown us that there are no boundaries. There's, these divisions between one thing and another just are imaginary. They don't really exist. But having said that, please do reach out to Sue Carlson or Teresa Patterson and get the form to request that your community be helped. We are going to try to help as many as we can on the ground. Anything else, Sue, you want to say about that, or Teresa?
I just might add that we have been sending containers for over 20, 30 years now. And usually we've been averaging 7 40-foot containers every year. This year, of course, we are still trying to make a decision whether or not we're going to be able to send containers. We do know that we have to, if we're going to send containers down, we do have to make a decision to send them by August, to collect anyway by August 17th. And sometime within the next couple weeks, I will know for sure if we're going to be doing that. And certainly we will open that up for sure to all the parish twinning programs or anybody else who wants to send down any kind of equipment or coat, mask, etc. So we'll let you know about that. We're having a meeting this coming week. The difficulty will be, of course, in accepting and receiving boxes and being able to keep everyone who's doing the working with the containers project safe. So,
Nat, I have a request here, I think from a physician of the same, Letitia Shea, wondering if you'd be willing to share your email contact. Would you like, I mean, is that something we can post? We don't want to overwhelm you personally either. We can go directly to Karis. You tell us what you'd like.
Let me think about that one, and I'll send a message to you all. Yeah, I think it's okay for I don't know, Hugh, what do you suggest? I don't know.
Well, I think that we need to field these individually because Nat's dealing with 168 hospitals and clinics. And I think we need to make sure he's able to focus on that.
Good
So
point.
let us field that.
Let me suggest this, poor Sue, you know, if the people on the call or anybody else needs to make connection, why don't you go through Sue Carlson and we will figure out what to do to get answers. But also I think you can, you know, write on our website is how to connect to the CARIS program and all the wonderful materials and free assets that they are that they're making available. We have that direct connection. There is another note here. We should probably note Missionary Flights International does a great job shipping, flying stuff in at $1.60 a pound, 2 to 3 weeks in customs normally. Just enough time for this thing to really take hold. But so that's in the chat if anybody wants to take note of that. I think I've pretty much covered the questions that that are here. It's been a long day and it's Mother's Day, and we have some mothers with us on the panel and others I'm sure that are still in the room. So with everybody's permission, I think we will invite you again back 2 weeks hence, and thank all the panelists for joining us here. Thank you all for coming. And you know, I just want to conclude by saying, we've been working together primarily Parish Twinning, Smallholder Farmers, Raising Haiti, the HELP organization, Lide organization, and now, you know, with CARIS. And it seems like those relationships are now, being taken to another level through this emergency. And I expect that there will be long-term possibilities unfolding in this process. In fact, we're already talking about, for those of you Parish Twinning folks that are on the call, that we are developing a program together called Community Twinning to bring other folks on board. We're looking for community twinning leaders. If this makes sense to anybody on the call, send Sue Carlson. You can post that again, Josefina. Send her a simple email that in the subject line says community twinning. And basically what we're doing is we're trying to expand on the amazing work that they have done for nearly half a century by inviting others to take a leadership role. We'll be supplying extraordinary assets in the form of stories of the amazing work that Parish Twinning is doing, and the amazing work that Smallholder Farmer Alliance is doing, and the amazing work that HELP is doing, and others, to take those stories to, even if someone has no means, I would love to see Haitian diaspora members arise. And even if an individual, whether it's that individual or anybody else, doesn't feel like they have a lot of personal resources, it doesn't mean you can't tell a story. You can't get the great stories. I think it's the most amazing story that's going on in Haiti, really, quite frankly, and taking that to others who can help, and building a community that can look like anything, different denominations, different churches, different religious organizations, businesses, corporations, social clubs, individuals, you name it. It's absolutely endless, the possibilities, and we're working on that. You'll hear more about that. If anybody is inspired to take a leadership role in that, just write community twinning on the subject line and send it to Sue. And with that, I want to thank each and every one of you, and maybe give you a chance just to quickly, before we sign off, say a few words in closing. How about you, Connor? Let me help unmute. Hold on. There you are.
Great. Okay. Yeah. Just want to say thank you again to everybody who put this together, everybody who's working hard on this, and everybody who's participating in the call.
Thank you so much. Steve, what have you got? Can we unmute you here? Let's see.
Much better this time. I appreciate the great work you're doing. Keep it up, and we'll help any way we can.
So great to have you, really. Teresa, what you got?
Well, great job, David, and the rest of the panel. We'll have a lot of hopefully news on the next chat in a couple weeks, and hope all of you will join us.
Thank you. I think I just unmuted you, Timothée. Have any final words for us?
I would like to thank you all guys for your commitment to help Haiti on this difficult time. So may God bless you.
Thank you. Thank you. Nat, what have you got?
Yeah, just thank you all. And, I think, unfortunately, this is going to be with us for quite a long time. So, I think there's plenty of time to develop those community relationships and the parish linking. I think they're really great ideas, and, very happy that we can be part of this, wonderful forum with you all. Thank you.
So happy to have you, Hugh.
Well, I'm excited about being able to collaborate in a way that breaks down previous boundaries between organizations, because, it's the spirit of oneness that we need to invoke to be able to help to overcome this, and then have a path forward that charts new territory in collaboration.
So well said. And I would also just like to thank you personally for your leadership in so many amazing areas. It's just amazing to be able to work with you and everybody on this call, really. Godinson, have you got something for us?
Yes, thank you all for having me taking part in this project. It's very amazing how we can see opportunities to save lives, and that's very exciting.
Thank you so much. And you are, as Hugh said earlier, I mean, boots on the ground. Within an hour, you were already, becoming a force of nature and evidencing for all of us what young, determined Haitians are going to do. And we're really just so excited to follow your lead. Sue.
Yeah.
Thank you.
I'm just going to say it's really exciting to be working with everybody here. And I do think that there's a big opportunity to help save lives. And I'm just delighted to be able to do my part in trying to further that along.
So I'm trying to unmute, but it's not working. We've got, I hope I didn't forget anybody. If I did, you raise your hand. But we've got, I'd like to give a special shout out and thanks to our crew who makes all of this. I could just tell you, Zoom or any of these webinar programs are still in their infancy. So you really need to have some muscle to be able to get through stuff. And we wouldn't have been able to do this without Boyd and Josefina. If you would just say a couple words to us before we sign off.
Thank you everyone for all your amazing efforts and for having me be part of it.
And I echo that as well. And it's a pleasure to be of service to everyone and get this message out to the world. And the work just starts now, right? We get to share all of these videos and all this time that you guys have taken and make it known throughout the whole world. So very much looking forward to that.
Thank you all so much. Again, we'll be back in 2 weeks. I don't know, Boyd, are you able to play Jack's gift for us as we're leaving?
You betcha. You betcha.
There you go. Well, best to all of you, and we'll look forward to seeing you soon.
And happy Mother's Day.
Happy Mother's Day.
Bye.
This I wish for you, to live in unity and peace. This I wish for all of you, to be as waves of one sea. This I wish for you, to live in happiness and love. This I